the question came to me from a couple of people here recently that asked me, Eric, we've kind of qualified you in your business, but how do we know how I'm qualified to actually be in your business? It was a great question. It was a question. Yeah, a great question.
Because, folks, even though this is not a franchise, so we don't make you jump through the hoops that most franchises do, but we also want to know that you're going to be successful in this business. And so the reason we have a webinar today that's talking about, are you qualified to own your own business? There's a lot of things that people don't think about when they're researching a business opportunity or a franchise, and we want to cover those so that you are, even whether you're looking at us or something else, you're asking the right questions.
Yeah, so one of the first things that, as you're looking at trying to figure out if you're qualified, you ought to be looking at, as you're doing your due diligence, you need to really find out, is the business that you are looking into, whether it's a franchise, whether it is a business opportunity, are you doing your due diligence? And so, Patrick, we're going to talk about all these different things. So, how does one go to examine and evaluate and check out the value? What about the investment? What about the potential? I think between you and I think hopefully we're going to get to that today, but obviously you've done that in the past. How have you gone through of figuring out if one business is good for you or not?
Well, I joke about it sometimes in our classes when I appear there at the hotel, and I tell people I am a serial entrepreneur. Well, you can ask my wife, Linda, if that's not true, and that just means that I've tried a lot of different things. I have started a lot of business over my business career, but every one of them has been successful in this respect. I did my due diligence. I did the research necessary to prove to myself that the business was valid, that it's a real business, it's not a fad, it's not here today, gone tomorrow, it's based on something that's real. Well, Eric, I can't think of anything that's more real out there than people getting sick, going to a doctor, the doctor needing to get paid, and somebody has to bill somebody to make sure that the doctor does get paid. That's where our licensees come in.
Well, the medical field in and of itself is ever changing. We've got what we knew as Obamacare. We thought it was going to change maybe this last week. Now it's back to maybe staying. We have no idea what's going to happen in that field. Does that impact, Patrick, what someone can do in this field, especially in medical billing?
Well, when it was first introduced, 8 years ago, we basically were wondering, how's that going to affect the doctors? Well, what happened was the doctors realized that all of these rules and regulations that the government comes up with for healthcare, that's tough for them or their staff to keep up with. So what a lot of doctors decided at that point was, and this is why we saw a huge surge of sign-ups amongst our licensees for doctors, is that the doctors said, I don't want to deal with all that. I want somebody to handle the business side of my practice and let me focus on the thing that I'm interested in, which is helping patients get well.
Right.
And that worked out real well for us. So, again, we don't know where this is going to go. It looks like that Obamacare, or the now it's called the Affordable Health Care Act, that's going to be with us for a while, probably. And if so, then nothing changes because it's been just like it has been in 8 years. Now, Eric, I just told you before this webinar started that I got a report of the sign-ups of doctors from last month, and we have broken all records. All records for the past 23 years have been broken in this past month. And March is not even over at the time we're recording this, and we've broken the record for March. Yeah.
Well, that will kind of help us answer Brendan's question here, because he's asking the question, doctors in my area are joining local hospitals, closing their individual practices. Isn't this a threat to the ABS model? I believe what you're saying, Patrick, can help answer that question for Brendan, and then we'll get ready to go into the next slide.
Well, there's no question that hospitals are trying to buy out doctors. They're their competitors, right? And they also want the doctors under their control. The problem is that a doctor doesn't realize that they are giving up their patient base completely, and we've seen many doctors who've gone to work for a hospital realize that it turned out to be just a job. They were putting in long hours. They were limited on their income. They didn't have any control over what they did or didn't do, And when they did want to go back into private practice, they had to start over from scratch.
Right.
And so that will always be, that's not something that's recent, by the way. That I just talked with Dr. Vicki Rachner, who we'll talk about a little bit later in the webinar, and she told me, Patrick, that's been going on for the last 20 years. That's a thing that's just always been happening, and it always will happen probably. But just as many doctors are coming back from those groups and the hospitals back into private practice as are going in, so it's kind of a wash.
Yeah, it's a moving flow, so it's always happening. So Brendan, keep that thought in mind. You know, we do have some magazine articles that we might be able to get to you. So just get with the person that brought you here to the webinar. They might be able to get you that. And it's just called the myth of doctors going into hospitals. So it's a great article.
It could be that in a particular area, like I don't know what Brandon's area is, but it could be that maybe there are some. Now, how he would know? Let's say there's I don't know 1,000 providers in his area. How he would know that a big portion of those were actually going out of practice? I don't know. Maybe he's done some research that I don't know about. But the fact is, guys, there will always be. There's over 850,000 medical providers in the United States, and they're not all working for hospitals or groups. Many of our licensees are still signing up groups of providers, practices that have 6 to 30 doctors in them. And
I believe you're going to interview somebody next week that has done that. So
yes.
For those that have questions, tune in next Wednesday to our webinar next Wednesday, and you'll be able to see that. So talking about people doing their due diligence, here's one of the first things that you ought to be looking at is the company's history. You know, Patrick, I know that you mentioned something. Is this a fad? Is this business opportunity a fad? Is it going to kind of come and go? I mean, Patrick, you and Linda have started doing this, you could almost say 30 years ago, and it's still going on.
Yeah, I thought we would be out of business within a couple of years. This was back in the late 80s when Linda started doing medical billing, and I thought, well, gosh, in a couple of years, all doctors will have the ability to file their claims electronically. See, because that was the big deal. Most of them were on paper back then, and we were doing it electronically, so we thought we had a little niche there for a little while, and then eventually all doctors would be doing it electronically. Well, there are doctors who do it themselves in their own office using their own software and their own staff, but believe me, even those doctors would rather it be done by somebody who is a specialist who focuses on this all day long and does it not just for one practice, but for many practices. They would rather outsource. And so that'll always be the case that we feel like that this is going to be around for a long, long time.
Yeah, I mean, I think there's a picture of you and Linda and the kids when y'all first started doing medical billing. That's a few less gray hairs back a little bit there.
Pounds too.
Yeah,
that's my son Adam there, and my daughter Sarah. They're both involved in the business still. So this is a family business, and we're proud of it. It's been great for us, and it's been wonderful for many of our licensees. You'll hear from Tierney Martins next week on my interview with her, how this has been a blessing to her and her family as well.
So there you go, folks. Check as you're doing your due diligence. Truly look in the history of that. You know, is it a business that you want to be a part of? And one of the things that you can find out about the history, again, talk with other licensees. I think, Patrick, a lot of times you and I don't talk a whole lot about that on webinars, but just the fact that you've got the opportunity to talk with other licensees, take that advantage and go give those folks a call.
Yes, our coaches, our business coaches here at our office, those are the people who sent you the email to bring you to this webinar. Folks, they can give you names and phone numbers of people all over the country who've been through our live training workshop here and have gone out and built their own very successful business. So you can ask them all the questions you want. That's the best way to, I think, to do due diligence on a business like this. Ask the people who've been there, done that, and have the T-shirt.
Yeah, there you go. As you're doing your due diligence, and it begins by researching the business, ask about where they stand with the Better Business Bureau. I know a lot of people don't like the Better Business Bureau, Patrick, and they can twist things up and all that, but they've been around since dinosaurs, I believe. So they are somewhat of a standard there.
Yeah, All I know is that they are one of the last remaining non-fake websites out there for reviews. Now, not that there's anything wrong with Yelp. We're highly rated, I think, on Google pages and on LinkedIn and all kinds of things out there. But the Better Business Bureau is dealing with businesses that have been in their city. Most of them have done some research on that business and know whether or not that business does what they say they're going to do, because people can file complaints with them. And if the company doesn't respond to that complaint and take care of that, then of course they get a bad rating. We've got an A+ rating. It doesn't get any better than that.
Yeah, got positive reviews. There's no neutral reviews. There's no negative reviews on us. You can look down here at the bottom left-hand corner. You can kind of see the progression of the years that ABS has been around. I think it goes all the way back, Patrick, to whenever really you and Linda incorporated. I think that's what I looked at.
Yes, I do want to mention one thing. Right there above the A+, there's a little statement there about the fact that this business is not accredited. Let me just address that, because, folks, all that means is that we have not paid the dues, the annual dues of, I don't know, $1,000 or whatever it is, to join the Better Business Bureau. Now, some businesses do that because they think that's going to help their ratings, or they want to support the Better Business Bureau and whatever. Nothing wrong with that. It's just that we haven't needed to do that, because you can't get a better rating than the A+ rating.
Right. No, that's a good statement there to bring out. All right, so we're going to move on to some other questions, and then we're going to be looking about, as you're doing this, what is the potential market for your services? Patrick, I know that we get franchise magazines all the time. You get a ton of, new businesses that are coming out. Everything from, cleaning houses to doing windows to scraping gum to doing all sorts of things. But really, what's your potential market out there as you're doing the research for your business? I mean, that's important.
Yes, it's very important, because if you don't have a big enough market for your product or service, then obviously you can't make a living at it, much less make a lot of money and get rich at it. So the potential market for your service is very important. We happen to have a huge market out there that you cannot even begin to cover. Eric is listing some of the types of specialists out there that you can bill for, help them with their revenue cycle. These are doctors that are in all sorts of different areas. Here's another screen full of them, and some of them I don't even know how to pronounce them, much less know what they mean. But it doesn't really matter. It just means that you can go after any one of these, because all of these folks need help. They're either now billing for themselves outside their office, they've already decided to outsource, or they're doing it themselves. And we see, like I said, we set a record this past month of new doctors being signed up. Well, how are licensees signing these doctors up if they already have it outsourced or they're doing it themselves? It's because of the advanced technology and some of the advantages that we're going to talk about here in the webinar. But look at it, it just goes on and on. I think you're on page 4 or 5 there, aren't you?
Yeah, it just goes on and on and on. And I think some people think that, especially when they first start thinking about getting into maybe medical billing, they think they're kind of focused in on family doctors, and then they kind of think from there it just goes to hospitals. But folks, you got to understand that everything that we're showing here, and I think if people go back and listen to, I think it was Bob Wilkie, if I can remember, I think he does billing for massage therapists. I mean, so apparently they're utilizing the same codes as any type of doctor would. So if you got to think of it, it is provider, health provider.
That's a good point, Eric. We use the term providers rather than physicians or doctors, because there are companies who provide healthcare services that can bill Medicare, for example. My wife started doing billing for a durable medical equipment company that rents out hospital beds and wheelchairs and oxygen, that type of thing. So there's lots of medical providers that you can provide these services for that are not necessarily MDs.
Correct. There you go. That's a great way to put it. Before we move any further, I'd like to try to fulfill as many of these questions that come in. Christopher is asking, Patrick, what is the biggest reason why people might fail in this business?
That's an interesting question. We get that a lot from folks. And I guess they're just worried. Maybe their self-talk inside their head needs to be changed. Maybe they need to read my book, for example. That is, they are always thinking about, maybe they failed at other things. I don't know why that question is asked. But folks, it boils down to this. The only way you fail in any business is if there's not a market for the product or service, or you can't be competitive in your marketplace, or if you just don't get out and do anything to get clients. Now, we teach about a dozen different ways in our live workshop training as to how you can go out and market this. And we've had licensees that I've interviewed over the years that have used every one of those methods to get clients. So they all work. Not that you have to use all of them, but you just try one, and if it doesn't work, you try another. And the only reason that people would fail, I think, Eric, we've done webinars specifically on this topic, of course, is because people try to reinvent the wheel, and they don't follow our system. We're called American Business Systems for a reason. We have a system that works, has for 23 years, and if people follow it, they will be successful.
Absolutely. All right, so let's get moving on. Thanks for the questions that are coming in. Folks, if there is a question that's just kind of ringing in your head, put it out there. If it kind of fits where we're at or in between a section there, obviously you can see that we'll jump to it. Again, as you're trying to quantify or qualify the business that you're looking into, you need to know what makes my company and product services unique. And I think that's where you were alluding to just a minute ago, Patrick, because we showed kind of the field of how wide the market can be, but aren't all doctors already doing billing? I mean, come on, let's get down to the brass tacks here. Doctors are already doing billing.
They're doing billing. Either their staff is doing it with their own computers and software, or they've outsourced it to another company to do it already. So how is it that we can go out and be competitive in a marketplace like that and sign up doctors? Well, one of the reasons is because of our unique system. We have a system that Eric is illustrating there that's very unique in that we have 4 components of our system that's completely standalone as far as what the competition has out there. For example, some people have a patient portal, but that's a standalone thing that's completely separate from their integrated billing and practice management system and their electronic health records. Ours is all tied together so that we have the patient portal on the front end that the patients can get into to see all of their history, all of their prescriptions, and so forth. Then we have the electronic medical records that the doctor can see all of that as well. Using their iPad, usually they're in the office actually looking at the patient and looking at their iPad and seeing all the records that have been put in there. And that goes, of course, to you on the back end as one of our licensees actually managing the claims and submitting those claims. Now, here's where it gets really unique, Eric, and that's in the bottom left-hand corner there, the clearinghouse. Folks, a clearinghouse in most cases is a third-party entity, a company that was set up just to take your data electronically, reformat it the way each one of the insurers want to see it, and forward it on. And during that process, of course, they're scrubbing the claim to make sure that there's no errors. Well, we do that all internally. Our clearinghouse is built in, so you don't have to make any choices about clearinghouses. You don't have to do any paperwork with clearinghouses. You don't have to worry about your support from the clearinghouses. We do it all, and that's why our rejection rate is less than 2%. Now, Eric, you might want to talk about the fact that most doctors are getting a very high rejection rate. Most of them.
Right. And it's because, folks, because as we're illustrating here on this slide, we're really trying to show you that the clearinghouse is not separate. It's it's inside of the billing platform. So if you can grasp this in pictorial format, as we're trying to show here, if you think about it, our system is the only system that can directly connect and communicate back and forth between the insurance companies. So let me kind of share the unique proposition here, because everybody that is, you're thinking about, well, how am I going to market this to the doctors? What's my unique proposition here? Folks, the reason that the rejection rates are so high in so many cases is because one simple little step is not being taken care of in the doctor's office, and that is always checking with the patient before they see the doctor to verify that their insurance is valid. Now, I was talking with someone that's actually on the call today. She's an RN. She understood that very well with me yesterday, and she understands. She knows that if the patient that's going to be seen by the doctor, if that insurance is invalid, it doesn't matter how well you as a biller does billing, or how well the doctor does their coding, and how well all that's communicating. If you don't have that started off in the front end right, then the claims are not going to get paid.
Right.
So we're illustrating here that right here is that it can all start with the patient right through the patient portal. The patients can literally check in from home and then verify all their insurance before they get to the doctor. Then all that information gets taken to the doctor. Once the doctor gets through it, then it goes into you to do the billing, and then it will go to that particular insurance company. And one of the fabulous things about this, Patrick, the doctor can see the patient the same day, get that information to you as a biller the same day, and actually get that claim to the insurance company the same day. There is your unique proposition here, and this is how we're going to help you. And as you stated earlier, Patrick, this is why we're seeing such high returns from our licensees gaining new doctors every week.
Yeah, most doctors don't see their money for 30, 45, 60, 90 days sometimes. Right. We can actually get the doctor their money sometimes the same week. That's how fast we've seen it. Now, on average, it's probably closer to 2 weeks, but the point is it's a lot faster than most systems can get that money. And believe me, that's a big thing. A turnaround of your cash flow is real big to a doctor because they do have payroll and other reasons why they need their cash to come in on a regular basis. And so because of our system, we get them their money as fast as we can.
And that's just one part of the unique part. Patrick, I'm going to get to the next slide, and you can kind of take it from here, and we'll kind of walk through these other positions. But there's some incredible unique features here inside of our system.
Yeah, here's one of them right here. On the iPad, as I said, the doctor could be actually visiting with the patient on the iPad, and within that patient's record, the doctor can actually draw with his finger right on the iPad to circle where the pain is or make notes of any kind. This is very unique, folks, because our system is not an app of any kind. The doctor's actually addressing and assessing right through his browser on the iPad. And so it's the most real-time system that you've ever seen. It's cloud-based, which means all the data is residing on our servers. We have 2 of them in the United States that are both redundant. That means they're backed up regularly on the same basis. And all the data is the same on one as on another. If one went down, you've got the other one as a backup instantaneously. And the doctors love this part right here, Eric, don't they?
Absolutely. Yeah, e-scripts. Or how the prescriptions come in, because the system is locked in with what's called SureScripts. It's the nation's largest e-prescription network. It's certified. We can actually pull down right over here. I'm going to get my little drawing tool over here. Right here, the doctor or the nurse could literally click that button right there, and it'll fill in all of the prescriptions that particular patient's on without even asking the patient, tell me what prescriptions you're already taking, because it's already in a database somewhere else. So we can pull that information from one source to another. And not only can they do it from there, but I mean, it's also accessible on their phones, where if the doctor's out of town and they need to fill a prescription for a particular patient, they can do all of that via their phones there as well. But that's just one of the great things. Patrick, this is the future of medicine right here.
Yeah, I see we have a question there from Nitish. Nitish is asking, is there telehealth also included? Well, there you are. You're looking at it. Some people refer to it as telemedicine, telehealth. We refer to it as an e-visit. But basically it means that the patient can go into the patient portal and set up an appointment with the doctor virtually. In other words, they don't have to even get in their car and get out of their house. They can set, just like Eric and I here on these 2 videos are visiting, they can visit with the doctor and chat with them via text right there on their computer or their iPad.
And actually, it's speaker and text going back and forth. So if the doctor needs some clarification, they can type it in and they can do all that and keep a record of that going there as well. So, right. Yeah, absolutely. This is the future, folks. And Patrick, I believe there are business opportunities that are just selling this part to doctors right now, e-visits or telemarketing?
Yeah, sometimes we get this question because somebody has talked to one of those companies that's selling the fact that they have telemedicine that they can market to doctors. Well, this is just a part of our system. It's been a part of it for the last 7 years.
Right. Yeah, absolutely. So, folks, that's what's, when we're going again, quantifying and qualifying the business that you're looking into, what is your unique proposition? What's the thing? So hopefully we'll be able to share a little bit about that with you. Moving on to another question you ought to be asking is, do they have an advisory board on their staff? And Patrick, one of the things that you mentioned earlier is we kind of have that there, and I know that we've kind of got it broken down. We just took this snapshot from I think this is actually from our website showing this, but we got Dr. Rackner and Terrence Patterson, who's a marketing consultant, and we got Janet Weiler, who's a certified professional coder. These are the people that we're going to for help for our licensees.
Yeah, and they're just a small portion of our network, Eric, because even though they're on our advisory board, we have many, many people that we can reach out to that are a part of our network. This is one of the advantages of not just starting your business on your own, even though there have been people who have done that. I mean, my wife and I did it, right? But being a part of something that's big, like American Business Systems. Now, we're going to touch on this just a little bit later when we show the certification that we do through the Medical Revenue Management Association of America. But that's very important that you know that we are the nation's largest network of medical revenue managers. So that just means you're a part of something that's much larger than you just working out of your spare bedroom in your pajamas.
There you go. Absolutely.
But you may be. That may be fine.
Absolutely. You can certainly do that. Christopher, thanks for helping us out. We were talking about unique propositions and all that. Christopher says the economic term is called comparative advantages. Comparative advantage. Right. So there you go. So put it there in a proper standpoint.
Yeah, thank you.
All right, so another question as you're going through this is, what about success stories of current owners? Patrick, I know that we've already dealt with, and I know everybody wants to know, what about all your failures? I want to talk with your people that are failing or have failed in the business. I don't know why any entrepreneur would want to talk with anybody that's failed in the business unless they're just trying to figure out what they did wrong and they don't want to repeat that. But really, if you go look in the bookstores, you're not going to find books on why people fail in business. You're always looking for books where you find people for success. And so this is where we're wanting you to go. And we've talked about that. We've got literally, I don't know how many people on our list, over 100 people that people can actually talk to on our reference list. And we just got, some of these pictures up here, because these are some of the people that actually do take some of the calls here. But
unfortunately, somebody who doesn't go out and do anything with this business and sign up a client, they're not going to take your phone call. And for that one person, let's say out of 100 people, we have one person that has not done anything with the business, or at least hasn't been as successful as they thought they could be. That person is not somebody that you want to talk to. They're not the person that would give you the advice. Talk to the people who've actually done it and ask them what they did right. There's two ways to look at it, of course. You could learn something from somebody who failed, but all I can tell you is that the people who failed are the ones who tried to do it on their own, reinvent the wheel, or they just didn't go out and do it. They didn't get off their chair and go out and do it.
I bet, Patrick, every one of these people that we're showing and every licensee reference that we have, every one of these people have failed at least once or twice in getting a particular client. So, folks, if you want to talk with people who failed, you're actually looking at some of those folks that are right here.
That's a good point. I can tell you some of the things I did when I first started going out and trying to market to doctors. Folks, this is a very unique product and service. We realize that. That's why we tell people that they can go through our training and learn all the different ways that we teach them to market, as well as all the other proprietary information. And then at the end of the week, if they don't think that this is something for them, they can ask for their money back. We'll cover the guarantee here in a second. But here's the point. There are always going to be a certain percentage of people in any population that are not going to be as successful as the others. And the way it works usually is it's the old 80-20 rule. 80% of our business is brought to us by 20% of our licensees. That's just the facts. In any organization, 80% of the people that are a member of a church or synagogue do 20% of the work, and the 20% do 80% of the work. Well, that's true in any organization, any sales organization as well. So from a marketing standpoint, there are going to be people who fail. These folks have probably all failed, and I failed many, many times. We just didn't quit because we knew that it was a system that worked, and all we did was continue working the system.
There you go. All right, so as we keep going on, as you're doing your due diligence with qualifying the business that you're looking into, ask about ongoing costs and fees. Now, Patrick, before we go into this, let's talk about our ongoing fees, or our do we have franchise fees? Do we have royalty fees that are going to be followed up with these new licensees?
Yeah, well, I think you've illustrated it on that next slide pretty well, Eric. Folks, here's our ongoing fees. It's nothing, zero. We never charge our you can ask some of these people that you call our references. Ask them, what have you paid directly to American Business Systems after you paid them that initial licensing fee for the training and the support and so forth? And they'll tell you, not a penny. We don't have any hidden fees on the back end. There are no, ask some companies, for example, now after the first year or the second year, or how many every years you give me of support, how much is the support each year after that? If it's another $1,000 a year, then, you know, in 10 years, you've spent another $10,000 for what we're going to give to you for free. That is, it's included, I should say, in that initial licensing fee. So there's no user fees, you know, no seats for the software for each additional person. You can give as many people access to your system as you want to in your own office, in the doctor's office. The ongoing training and support is always free. And as Eric's going to illustrate a little bit later, we do ongoing webinars just like this one, except for our licensees who've been through our training on a different day usually. And we've never charged them for that ever. And we do it week after week after week.
And I'll tell you one of the things, and so remember this, folks, we're going to also show you one of the other support mechanisms that you get is that we're doing all of your demonstrations for you, for your doctors. And we don't charge you for that either. That comes along with the package, whether we do one of those demos or whether we do 100 of those demos. There's no additional fees to go along with that. So just remember that.
Now, the only thing that you would ever have to pay for, of course, is additional marketing materials. Now, we give over 2,000 pieces of marketing material in the package, which is adequate for most people to get their first client. But if you need more, for example, we're going to talk about the book that you can use. You would have to buy these books, of course. So there are costs for the physical things that you might need, but not the ongoing telephone and email support and the ongoing webinars and training that we do. Eric, I think we're going to show the some screenshots from our licensee website too, and there's no access fees for that either, ever.
Right. Absolutely. Marketing strategies. How are you going to get your clients? These are, again, as you're doing your due diligence, you know, unless you're just opening up a Subway, you know, sandwich shop and you've got the premier corner of the market where you're going to place that part. I mean, obviously, you're just going to have you're going to have flow of traffic just because of that. But when you're researching, you're doing business, and you're looking at something like what we're showing you, how are the marketing strategies for obtaining clients? And that's what we're going to show you right here.
Yeah, Eric, I've done some calculations on this. We've probably put in over $200,000 in development and graphic fees for developing all the different marketing tools that we provide for folks. So when you come to our live training workshop, you're going to be able to touch and feel every one of these marketing pieces, except maybe for that booth there. That booth you see in the bottom right-hand corner is actually 10 by 10 foot, and it's lit up, as you can see on the top there. That's for trade shows. We'll show you how to set up booths at a trade show and have the prospects come to you. There's postcards here illustrated, specialty envelopes, books, and even some pills there for you. We have a very special medication that we give to you as a licensee. I think Eric has some there in a jar too. It's called M&M's. Right. And we have
It's a
flip
bigger
charts for presentations. And folks, again, it's all very professionally designed, and it works. It's been tested.
Yeah, and that's the good part about it, is that it has been tested. And now we're getting into that part about the live. We're the only system that will provide live demos for you. So if you're looking at any other business, and especially in, let's just say, maybe even in medical billing, there is no other group of people, business opportunity like ABS, that's actually going to do your demos for you. Patrick, that in and of itself can land your first client right out of the gate.
Yeah, this is hard for people to wrap their brain around, because for a company to do these live demos, and believe me, the doctors want to see the technology. You know, if you go into them and to say that you take over their billing, they kind of want to know, is this, cutting edge, leading edge technology? Well, we don't just tell them that or give them a brochure of some kind. We tell them we will actually get on a live webinar, just like we're doing this today with you guys, except we're actually on the internet with the system live, showing them exactly every aspect of our technology. You can be on there with them, of course, watching and listening and hearing what questions they ask. We answer all the questions for you. And Eric, I think we're at the point where we're closing about 75% of these at this point, right?
That's correct. So you're wondering how you get to the doctor to this point. Once you get to the doctor at this point of what you've learned with all the marketing and what you learned in training, and you have all of the things that you got working on your end, when you get to the doctor at this point, you are almost home. So it's basically, we're even going to show you after this demo's done what you need to do to wrap up basically the deal, and we'll again help you with that as well. So this is a huge part of your marketing.
Yeah, we've got all the proposals, the pricing, the comparisons, all the documentation that you need to present to the doctor to get them to go ahead and sign up and give it a try. But these demos, folks, they last about what, Eric, 45 minutes to an hour, I guess.
Right.
And we have a half a dozen people that's all they do is do these demos all day long. And so we're constantly, and again, there's never a charge to you for that, folks. And the reason for that, Eric, I think I'll go ahead and just share with people at this point why we don't have to charge anything for these ongoing support and training and the live demos. Folks, Our model is built on the fact that behind the scenes, we actually get rebate checks from our technology partners for everything that you do for doctors. So we're making a few pennies on every transaction, as well as you making money, of course, the bulk of the money on the front end. But we make a few pennies on the back end, and that keeps us wanting you to be successful. We're partners. You become partners with ABS. And so we're going to be as diligent as we can. I tell my staff, look, do whatever it takes to help those licensees get those clients, because obviously as a company, we have back-end revenue on that.
Right, and remember, you're not paying anything to us. We only get those rebate checks after we've helped you get a client. When you're going through our technology, as you're seeing here, we get that on the back end, and it doesn't come from the doctor. It doesn't come from your when you invoice the doctor. It doesn't come from any of that. It's strictly a deal that we have with our technology partners, because we're bringing.
I illustrate it this way. Whenever somebody goes and buys a car, they may think that they're getting the invoice price on the car, and they may be. It may look like the dealer's not making anything, but what they don't know is that General Motors or Ford or Chrysler behind the scenes is issuing a rebate check to the dealer for thousands of dollars that you don't probably even know about.
Right.
So
Absolutely.
that's the way it works with us and our partners.
All right, let's keep going because we've got just a little bit of time left here. Ask about territories, especially if you're looking at a particular business opportunity that may restrict you within a zip code or a few counties or whatever. But we want to show you your restricted territory with us. It's kind of coast to coast.
Ready? Drum roll.
Yeah, there it is.
Yeah, it's the whole United States, including little Alaska and Hawaii out there. I say little Alaska, even though I know it's bigger than Texas. I don't think about that.
Right. Absolutely.
And this is important, folks, because When you sign up a doctor in your local area, that doctor may know another doctor in another state. Well, you want to be able to get that referral from that doctor, and many of our licensees have done that. You'll hear Tyranny next week, I'm sure, talk about the fact that she's got clients outside of her state. There's a very easy way to do that. You don't even have to visit that doctor, because as a referral, they just want you to do what you've done for the doctor that referred you to them.
Right.
And
you got to cross state lines, man. Just keep going, keep driving. So,
you can do billing for any doctor in any state. There are no separate licensing situations or anything like that. It's all done through the same forms and the same system that we use for any other doctor.
All right, so now we're coming down driving down to you. What about your income potential? And so, folks, what we're going to do is kind of step through that with at least hours, and it's just as simple as what we're going to make it. There's no hidden things. There's no smoke and mirrors here. We've already told you that there's no franchise fees, there's no referral fees that come back to us. So what we're going to show you here is as basic as we can make it to help you understand what it is of what you can make.
Eric,
so just a minute. Yeah. Mm-hmm.
Hey, before you get into that, let me just answer one question here that's on the board that we kind of skipped over. We were talking about the trade show booths, and Salim asks, what is the charge for that? There is no charge for that, Salim. Now, we do ask that you pay the shipping cost to you and back, so there's probably, I don't even know what that is, but probably $150 both ways. I'm sure there's some charge there for that, because it's a big booth, but other than that, you don't have to rent it or anything.
There you go.
Sorry.
No, that's fine. We're actually keeping up with the questions here really well today.
Yeah.
All right. So we're talking about your income potential. So what we're going to do, we're going to talk with about one simple doctor, just a doctor that's, let's say, a family practitioner. And that family practitioner is going to see about 20 patients a day. So you take that times, each one of those is going to be basically what you got to understand here, and hear the term, a reimbursed amount of about $100 per each one of those patients, and that's going to come out to about $2,000 a day. So if you've got that $2,000 a day that the doctor's getting, how are you making money? So you're going to charge that doctor a percentage. Average percentage is about 6%. So you take 6% of $2,000 a day. That's making you $120 a day on average for one doctor. That's not too bad. $120 a day is not bad, especially for less than 90 minutes of work. So if you're looking at it maybe even as a part-time gig, you can think about, wow, I might have an extra hour and a half a day. Obviously, you're going to need to get the client first, but once you've got the client, servicing that client is really not going to take a whole lot of your time, and then making $120 a day. So your average earnings, that's for one doctor. So your average earnings,
20 claims, 20 patients or 20 claims in a day's time. And folks, believe me, 90 minutes is probably stretching it out.
That's really stretching it out. So if you take your 120 times 5 days a week, that's $600 a week times 52. That's $31,200 per year. Now, if you want to go look at that, go to our website under Income Potential. Let me get my little pointer here. Go to Income Potential. There'll be 3 categories over there you can look at. You're going to look at that first one, Medical Billing Income Calculator. You're going to put in one doctor seeing so many patients, this, that, and the other, and you can see this is how we come up with that particular number right there. So with just that, you can make $2,600 a month or $31,000 a year working I can really say less than an hour. So you can go to our website, go to Income Potential, go drop down to that menu, and you'll see how that works there. So we want to at least kind of give you an estimate of what you could do. Now, if you can do one doctor seeing 20 patients a day, for less than an hour, basically, of work, how many of those could you do, and then just multiply that out to how much you could be making per month?
How much was that? What was the annual earnings on that, Eric? Can you go back there?
That's right here, 31,200.
Okay, so I tell people, Eric, look, you know what you're making now on your current job. If you're unemployed, you know what you'd like to make. So just do the math in your own head. How many of those doctors earning $31,000 a year from those doctors, how many of those do you need to earn the kind of living that you need for your lifestyle? Mm-hmm. Is it 2? Is it 3? Is it 5? We've got licensees that have over 50 to 60 doctors. So you can make this as big as you want it. There's no limits to the income that you can make on this, folks. Or you can keep it as small as you want. Maybe you don't want to grow very big and have to manage, other people doing the work for you. You want to do it all yourself and just earn what you can. Believe me, after you get for about a handful of doctors, you're going to probably need some help, but you can still make a fairly decent living just doing that. We have licensees that have kept it small even after being with us for years and years.
Yeah, absolutely. All right, we're kind of getting close to our time limit, so we're going to try to jump through this because we got a lot to try to cover in the next almost 6 minutes here, Patrick. You need to ask about your support. So we're going to kind of show that to you just real quickly. One of the things that we wanted to show to you, and Patrick's already alluded to this, is what's happening behind the scenes that you as a potential licensee just don't see. Patrick, you want to talk about this or what these upcoming webinars for our licensees are?
Here's our actual screenshot of our GoToWebinar panel there where we set up our webinars. Now, these are the webinars not for you folks that are looking into our business, but for people who've actually graduated from our classes here. And as you can see, starting April 6th, that's next week, we have what we call Cracking the Physician Code. It's a marketing series, 4 different sessions that will be held for us by Dr. Vicki Ratner. She's a retired general surgeon who now speaks at doctors' conventions all over the United States, talking to people like financial advisors and others who want to connect and do business with doctors. Having outsourced her billing herself and having written many, many books, she knows what doctors need, and they need to outsource their billing. She'll say that to you and has that in her books even. So this is a great series. It's live for our licensees. They'll be able to ask questions. Some of these will go into an hour and a half probably with the questions. And then we'll have a continuing series after this, Eric, that we don't even post on here, of course, that are just follow-up webinars where she just appears and lets people ask her all the questions they want about anything, and she can comment on different things. So it's invaluable training, folks, that you wouldn't get anywhere else. This alone could be worth thousands of dollars to a person.
Yeah, and these we haven't even blasted out the news that we're doing this. This is something brand new that was actually just created this last couple of days. So you see that there's no registrants. You're thinking, well, nobody's signing up for these things. It's because we haven't blasted out to our licensee base yet. But I mean, once we start doing this, these webinars fill.
What we're just showing there is to let you see, folks, that it's real and that we are having ongoing training. But this past year, 2016, Eric, we did a little over 45 different trainings for our licensees. That's 45 hours of additional training that they got, and it didn't cost them anything.
Right, absolutely. So the other thing that we're showing you right here real quickly is our licensee website. This is ABSLSS, so it's our licensee's website. I'm actually going to take you live to our licensee's website. We're here right now. Patrick, you want to tell a little bit about this, and I'll go ahead and get logged in, and we'll show some of the news that's coming up here.
Yeah, let me zoom in here. This is great, Eric. I didn't realize you were going to go live here. So, folks, you're actually seeing, as you would if you were one of our licensees, how you would log in to the site. Eric's logging in there. Of course, you'll have your own ID and password for that we issue to you once you've graduated from our live workshop down here. And then once you're into the system, of course, you have access to all of the things that we've posted there over the past years and years that it's been up there, several years at least. Eric is not wanting to log in.
Yeah, it should be logged in. It should be you should be looking at it right now.
No, we're looking at your login screen there.
Okay, let's make sure. I'm going to refresh my screen here. I'm in pause, and I'm showing the whole my.
Now we see it.
There we go. Good.
All right, now what you're looking at there, folks, is what you'll first go to there is on the left there. That's our news tab. Now scroll down, Eric, and you'll see, folks, that we've actually posted here in the last week 4 or 5 items. Yeah, I mean, this is an ongoing live site. Everything that's posted there, of course, have links to other pages on this site that have the items that they're talking about. So this is just the announcement of that item, and as you can see, each one of them have a little blue link. And look over on the right-hand side there too, Eric. This goes back to when we started this site in 2014, right?
Yeah, right.
So we've had hundreds and hundreds of posts. If Eric continues to scroll down there to the very bottom, you'll see that there's another link at the very bottom of this that would then go to the previous page. So you can go back in time and see everything that we've posted for the past 3 years. It just goes on and on and on. Folks, again, it's hundreds of hours of training and probably thousands of dollars worth of additional marketing materials and ideas, interviews, and forms that we've come up with over the years. Eric's showing you there, for example, the marketing section. Here, we go into every one of the types of marketings that we cover in our live workshop and have repeat webinars, recorded webinars there, so that if you go through our live workshop and forget something or want to review it, it's all right here. We used to give out DVDs, and then I realized that some computers don't even have a DVD player built into them, so we just put it all live digital right here on our site. We've got all the services that we cover there. We even have a getting started section. We have training, all sorts of training, tools, resources of all kinds. Folks, it just goes on and on. Now, why do we do this? Again, it's because we've spent the money, we've spent the time to continue to support our licensees because we make money when they make money.
I got 2 questions here. Now, Patrick, if you look at our time, we are going to be at the top of the hour, and we've probably got about 5 more minutes of the webinar. So, folks, what we're going to ask you to do, normally we go over time going over questions, but we had so much we packed in here today, we're just going to ask you to be patient with us. But I got 2 questions here about Dr. Rackner's sessions, one from Brendan and then one from Susan. They're both asking the questions, are those sessions going to be recorded for them in months ahead? So it looks like these people are thinking about they're going to become licensees, and if so, can they watch those themselves after becoming a licensee here soon?
Yes, we record everything that we do, folks, for future viewing, because we realize that you know, sometimes during the day that we do these live, you can't be there because maybe you're working a full-time job or out marketing your business. Yeah, so we do record all of them. Yeah.
So, folks, again, we're kind of going to overdrive right now. We're kind of going over time a little bit. We'll try to get through this. We're almost wrapped up here. But as you're doing your due diligence and you're trying to qualify the people that you're looking to get in business with, what about a money-back guarantee? Patrick, you want to talk about this? And I think we're going to be wrapping it up here as we get through this part of it right here.
No, I don't want to talk about that. What I want to do is tell people that if they want to be on next week's interview with one of our successful licensees, they need to go to the chat box in their GoToWebinar control panel there. So open that up. It's somewhere on your screen there, and look in the chat box, and you'll see a link there. That's a link where you can go and register right now for next week's webinar. And even if you don't think that you may or may not be able to make it, again, it's recorded, and we'll send you the recording link. Okay, now I'll talk about the guarantee.
Good. There you go.
It's
all right.
Pretty simple. There are no weasel words. It's taken right out of our agreement that you'll sign when you sign up as a licensee, and it just says if any time during the live training workshop you feel this business is not right for you, just ask one of my staff for a full refund, and it will be granted, no questions asked.
There you go.
There. That's pretty simple and straightforward. It doesn't matter what the reason is, or maybe they don't have any reason at all. Just say, I don't have a reason, I just want my money back. We will do it. Now, folks, you have to realize that hasn't happened a whole lot, or we wouldn't be in business, right? We know what we have, and that's why we're willing to offer such a strong guarantee. I don't know of any other company that does this, Eric. Literally, there is no other company in America that will let you come to their entire week-long training, see all the proprietary information, get all the handouts, hear all the questions asked, and be able to ask all the questions you want, and still ask for every penny of your money back. It just doesn't happen. But we have done that, you know, as you know, Eric, a handful of times over the years.
All right, so now everybody's been waiting. So you Eric and Patrick, you've said how I need to qualify a business. I still want to answer the question, am I qualified to own a business? And we want you to know this, that if you have been asking any of these questions to me or to any of the other business coaches here, any or all of these types of questions, we feel as though you are qualified because you're the type of people that we want to work with. Isn't that correct, Patrick? Those that do this type of due diligence.
Yeah, and let's face it, folks, this is not something that you want to jump into just overnight. It is a lot of money, I know, for a lot of people. It's not as much as a lot of franchises out there. You can spend $500,000 on them, but it is a chunk of change. And so you want to be careful. You want to do your due diligence and do all the research that we've pointed out to you today on this, no matter what business you're getting into.